Why we need a healthcare tax. There is a great debate on our current healthcare system. I say it's broken. Why should people wait until they are 65 to get great socialized medicine? A typical person on Medicare pays a little over $100 per month per person for great coverage. Under this plan, the government pays 80% of the doctor or hospital bill, and the individual is responsible for the rest. For a very low premium, a person can buy a supplemental plan to cover most of the shortfall. I do not see very many United States citizens complaining about how this works. It's been around for over 40 years. I was surprised when the Affordable Care Act was passed. This was a health care bill to help cover the poor. Unfortunately, it is too complicated and is not sustainable. Also, it discriminates against the non-poor who would like to pay a better price for health care. I've prepared a great number of tax returns. Some of my clients are poor, and some are rich, and some are in between. Over the past 2 years, I have seen the average cost of health care coming off of the tax returns now, with the premiums increasing by 10 to 20%. In short, some of my clients are paying up to 40% more for health care coverage than they were just 2 years ago. In addition, for those on Obamacare, many have seen their relatively small premiums increase by over 50%. Some of the insurers have actually left the marketplace for providing health care insurance under the Affordable Care Act. So where is this going? Even if the government kept the programs the way they are, eventually these plans would fail. Also, the increasing premiums across the board for both poor and wealthy seem unfair. So we get to the crutch of the question, why leave things the way they are? The answer is, it is time for a change. We need a healthcare system that covers everybody. We need a system that we can control the rapidly rising costs of medical procedures. Currently, we are spending 2 to 3 times more than most countries for the same medical procedures. We pay more than double for prescriptions. Why is this? Free enterprise and free markets. The lack of government control on fair pricing. Look about the example of EpiPens. Some companies do not have any reasonable ethics and charge whatever they can get, sometimes even to the point of pure greed. Unfortunately, many of us did not choose our parents or our genes. Some of the medical attention we need is not our fault. Some of the medical problems are self-inflicted. I understand that there can be no free lunch, but when the pricing for medical insurance should be universally set in a sense of fairness for both the consumer and the provider. At least Medicare tries to place some limits on pricing. However, for people not on Medicare, anything goes. Now they get to the point. If we had a 3% medical health care tax on W-2 wages and also on earned income, with matching from the employer, we could get away from the current system. It would work similar to Medicare, with individuals getting a supplemental insurance plan to pay the 20% not covered by the government. First, everyone would be covered that has W-2 wages or earned income. Second, as a group, the government could negotiate to get fair pricing on services and prescriptions. Third, the government could set up programs to help United States citizens to get healthy. The government could offer rebates to those individuals who exercise and eat healthy. Fourth, the government could make recommendations to the food industries to make more healthy meals and foods. Fifth, Medicaid could be expanded to cover those individuals who do not have earned income and are in need. Some people argue that free enterprise system is working. I would not agree with this. United States is ranked 37th in the world for health care, but we are ranked number 1 on what we pay. It might be a good argument if we spent more money and were ranked first for health care, but this is unfortunately not the case. Special interest groups and the self-preservation of the status quo have led us to believe we have the best health care system in the world. The facts say otherwise. I would recommend all Americans to do the research, and you will find out the truth. We in the United States need to change our medical system into a better one. If we are going to spend the most, then our healthcare system should be number 1. Now is the time for us to ask Congress to provide us with a fair and better healthcare system.